Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
The CDC reports autism now affects 1 in every 68 children, making it one of the fastest growing developmental disorders in the United States. April is Autism Awareness Month, and I know firsthand how an autism diagnosis impacts the entire family. So here with the facts this morning is Dr. Sue Hubbard, an award-winning pediatrician and the medical editor of KidsDoctor.com, and Dr. Preston Wiles, a nationally recognized expert in autism spectrum disorders and pediatric psychiatrist with Children's Health Center for Autism and Developmental Disabilities. That's a long title. Good to meet you and good to see you. So, hotly debated topic, I think, overall, but the million-dollar question is, why do you think that there are such a growing number of kids being diagnosed with autism?
I think the number one reason is that we recognize it much earlier than we used to.
Okay.
And we also identify it and we code it differently for insurance purposes and for children to get services. So all of those things together have added to increased awareness of autism.
Dr. Wiles, what do you think are some of the most common symptoms, the early signs that a child might be autistic?
The earliest signs are tricky because it's often the things that aren't there normally. Social smile, babbling by 12 months, reciprocal social interactions, developing language by age of 2 years. And so for a first-time parent or for people who don't think about this all the time, it can be easy to miss.
Is there an ideal age we should be taking our child in to be diagnosed, to be tested?
Yes. The American Academy, fortunately, several years ago, at 18 months and 24 months, all children should be screened using an MChat, which is a tool developed to see young children.
Okay, so if you think they might be, don't wait. Have them tested.
Well, when you're coming for your checkups, I think it's important for parents to know that even from the very beginning, that 2, 4, 6 month checkup, we are watching the interaction of that baby.
Okay.
While we're talking to that mom, we're watching how that baby acts, and we're asking questions about the very things that Dr. Wiles talked about.
Okay, so we all know that boys are more affected than girls statistically. The question is, why is that?
We're finding out the genetics is the short answer. Boys are more vulnerable to develop these developmental disorders, and it has to do with gene loading. So without getting into the details, boys affected by a much smaller number of genetic variants are more likely to develop the disorder. So there's a protective factor for girls.
I think it's only natural that parents can look at themselves and say, is it something I did, you know, to have my child predisposition to be on the spectrum? Is that true?
Most parents do question and feel guilty, and I always tell them it is absolutely nothing you did, because the genetics of the disorder, it's the most genetic disorder that we see in psychiatry. And the other factors, parental age can be a factor for very young women and for older men having children. But besides that, we really don't have an answer, and it's mostly genetics.
Okay, so from the point of the diagnosis, let's talk about some of the treatments that are available.
Very important to diagnose and hook the child up early with services. The best services are really educational and behavioral, to have the child in a setting where people know the disorder and understand how children with autism learn, so they can develop more appropriate speech, more appropriate social interaction, and more coping skills. Okay,
as the two of you know, huge controversy surrounding vaccines and autism. We have this movie Vax that's been talked about greatly in the last few weeks. What are your opinions on that? Do vaccines cause autism?
We don't know exactly what causes autism. As you just heard, it's multifactorial. We know genetics is a huge part. We know what doesn't cause autism. Vaccines do not cause autism.
And do you share the
Hundreds of thousands of children have been studied in very serious scientific articles. At this point, it's a crime to invest any more money exploring this non-possibility. Vaccines work. They're one of the miracles of modern medicine, and they do not cause autism.
All right. We appreciate your time. Thanks so much. All right. For more information about autism, you can visit childrens.com, and you can also follow Children's Health and the Kids Doctor on Twitter and Facebook.
More than 100 years, 30 locations, 50 specialties, countless ways to care, one new name. We're Children's Health, and we're by your side.